Welcome to Casey Cares, the voice of Kansas City nonprofits. We share the stories of local nonprofits and the individuals who drive them. At Casey Cares, we connect the nonprofit and business sectors to enhance the quality of life in Kansas City for our residents and our visitors. This Casey Cares segment is brought to you by the Ewing Marion Kaufman Foundation, www.kaufman.org. I'm Ruth Baum-Biggis. Since 1976, Nonprofit Connect has been here for more than 8,000 nonprofit organizations in the metro area. NP Connect, as it's most commonly known to those who are in the nonprofit world, focuses on providing education, resources, and networking, helping its members soar. NP Connect also explores issues that nonprofits may face, including health insurance. For this Ask the Expert episode, Casey Cares has invited NP Connect CEO Luann Feehan to join us to talk about this issue and its latest offering, health insurance. Luann, welcome to the show.
Oh, Ruth, thanks for having me. It's a delight to be here. I'm honored to make it onto Casey Cares and to share some information about what Nonprofit Connect is working on.
Well, we're delighted. We're going to talk about all things nonprofit, but I wanted really to head this because this is kind of groundbreaking territory for NP Connect. I know over the years, there's always been kind of discussions about insurance, health insurance in particular. So share with us a little background how this all came to fruition.
Yeah, so it came to fruition. We've been hearing about it for years, right? Nonprofits have really been in the need of being competitive in the market for health insurance, and particularly smaller organizations. And I mean, let's just be real, like when it comes to insurance coverage, there's a lot to be made from the insurance companies, and it just gets more attention in the mid to large size organizations and businesses. And so for smaller organizations specifically, we don't always get great customer service or get included in the opportunities. So we've been working on this for years, Ruth. We've been out working to find some brokers and some collaborations that would want to work specifically with small to medium-sized organizations so that we can serve their need. We did a survey a few years back, and it was overwhelming about how the need was great. So we're bringing health insurance.
Oh, you make it sound so easy.
Right.
I'm sure it was not that easy. I remember conversations a number of years ago when this topic, I think, really started to heat up for the small to mid-sized nonprofits. Let's face it, some of the bigger organizations are able in their bandwidth to provide that. I think there's even a national statistic like 87% of nonprofits offer it. Well, they forget that other, maybe 15%, which I think I would venture to guess the vast majority of nonprofits don't have those $1 million plus budgets. So at any rate, how did you really go about this? How did you get those potential folks in the health insurance business to listen and to bring them to the table?
Well, that is a really good question, and that's why it has taken us years to get to this point, because it is not necessarily always appealing. And we used to have a gentleman, Steve Metzler, you may remember him from years ago, that he really focused in on our market. And ever since his passing, we have not really had a whole lot of attention. So we acknowledged that void, and not only by listening to our members, right? Session after session, especially with our executive directors and our board members, they want to be able to afford health insurance, and they want to be competitive in the market. However, it was just hard to find. And even for us, like we have 7 employees, and we've even been challenged to, we can buy it and it's really expensive, but we don't necessarily get the customer service that we need. So over the years and talking with a lot of insurance brokers and different platforms, we ran across a brokerage company here locally that is interested in this particular market and has a lot of it streamlined already. It's automated, but yet there are people and individuals there to help with the customer service. And they were really all into the idea of working with small to mid-sized organizations, even down to 1 employee. So if they will take a look at rates, and even if they need to help get them on the exchange and maybe give them some tax credits, they'll do that too. So to answer your question, Ruth, it's taken us a long time, but we have found a partner that's really been great to work with so far.
Well, and this is pretty recently rolled out,
It is,
as
yeah,
I
just the middle of
recall.
March.
So tell us a little bit about how the offerings work. How do organizations then engage with this?
Great. So anybody can just send an email to insurance@npconnect.org. And we're working with the broker, right? So that information comes to us. We actually have two employees that are certified brokers. Even though we are not facilitating the insurance, we will forward that information on to the broker specifically. And then the way it works is they'll get some pertinent information about the organization, how many team members there are, and what their goals are. And for the most part, they will bring back 5 different options of the different providers. So the nonprofit gets to take their pick. So it may be Blue Cross and Blue Shield. It may be, gosh, I just went blank on what all the others are, right? But there's several, and they're covering 48 states. So it doesn't matter if the member or the organization is on the Kansas side or Missouri side, they can certainly get some coverage. And then once they get their proposal back, they can take a look at their options and then decide from there on what platform they want to go with and what they want their deductibles to be, and help put together the structure.
And since the rollout, what's the reaction? What are you seeing?
Overwhelming. Overwhelming. It's actually pretty exciting. So it's overwhelming, yet nonprofits move kind of slow, as you might know,
Yeah.
right? So the incoming results have been amazing. In fact, it has kept both of our teammates pretty busy and just fielding the interest and making sure that before we send them on to the broker, that the organization knows what they're looking for. And now the slow part is we've got a lot of proposals out, and I'm sure that many are trying to get it in front of their board or try to make a decision
Yes.
on what they want to do. So we're expecting kind of a big year in this area, but we also know it's going to take a few months just for that to cycle through.
To be really honest, is it reasonable? I mean, I think that's part of the challenge. I mean, healthcare is just, as we all know, has just skyrocketed and will continue to skyrocket. I don't have any, illusions that it's going to go the other way.
Exactly right. I think it's different for everybody depending on if they already have insurance, what they're paying, and if they haven't, what their budgets can afford. I can say for us, just to make numbers round, for us, we were paying about $100,000 a year, and we're down to 75,000. So it saved us 25%. 25,000 a year just by going off of our other plan, which we had been very loyal for a very long time. And then switching over to this. So for us, it is saving us real money at a time that we really need it. So I know that some of our other organizations that are looking into this have told me the same thing. So we know that we may not be right for everybody. We know that if your organization is already getting a great deal, that's wonderful, right? We're not here for everybody. We're just here for the organizations that either want to take a look at their options, or for the smaller organizations that don't feel like they've been getting any attention. We're going to give them some attention.
And as you mentioned, I assume there's a variety of kind of coverages, et cetera, and what you pay and whatnot. But at least it sounds like there's choice.
There is choice. There's choice of platforms, and then there's choice of deductibles and what plans within those choices that you want to get. So for us, as I mentioned, we're saving quite a bit of money, and we actually have a better plan than what we had before. So
That's fabulous.
it really is. Like, we're looking at this, and it's like, what took us so long, right? So yeah, I hope other organizations, I'm sure other organizations are going to experience the same thing. But one thing, Ruth, I will tell you that it's not a pooled insurance program. I know
Right.
some people are thinking that this is an opportunity to pull the nonprofit sector together. And while that is a fantastic idea, before we can even consider that, we need numbers. right? This is something that has
Mm.
been rolled out before. And one thing that the insurance companies want to know is like, what is involved in this? How many lives are being included in premiums? So we may get to a pooled option, but for now, we are not doing that. We are really here to help any organization, but primarily the small to mid-sized ones that have been suffering in getting good coverage and customer service.
Or not even having coverage for
Or
that
not even
matter.
having coverage, and most importantly, not having coverage. Um, and especially in this competitive market, and especially in this era of workforce and just how it's evolving and shifting, that we really need to have some options to be competitive with our other sectors and our other friends. And so this is a little bit more of a game changer to help be more equitable.
Curious, we have Nonprofit Connect here. I'm sure there are other like organizations in other cities, and hopefully you talk and you compare best practices. Are we unique in offering this? Um, Give us the sense in the states, I guess.
Yeah, we are unique in the sense that we are a regional organization, but you're right, we have peers or sister organizations that are primarily state associations across the country. And with that, I would say there's maybe two others that offer this. It's been something that we've all been trying to figure out for quite some time, but it's not easy. And it is hard to find the insurance companies that want to invest their time and their resources in the nonprofit sector. But let me also say this, right? When you pool together the nonprofit sector, we are loyal. Like once we find the right vendor, once we find the right companionship, we will be there for a long time. And we're pretty maintenance free other than when employees come in and out in the shifts of employment. So we're in a unique position, and we're happy to be kind of blazing the new trail.
That's great. Well, Kansas City, we always like to lead, if not
Right?
be number one, be in the top 10. Shall we say it that way?
That's right.
So, what's the best way then for folks to find out details, et cetera? Where can they go to see at least the beginning stuff of what they may need to do?
Right, so the beginning step is going to our website, npconnect.org, and click on resources, and you'll find health insurance there. You click on that, and you can learn a little bit about our program, and then just send an email off to the insurance at npconnect.org, and that will connect you with a team member at Nonprofit Connect. And we're going to talk with you a little bit just to make sure that you're what you're looking for and that you're ready for insurance. We're not going to sell you the insurance. That's not what our goal is.
Mm,
We just want to make sure that you are insurance ready and that you have your information ready, and then we'll send you on to the broker to get you fully established and just get some bids, right? I mean,
right.
this is just an opportunity. There's no commitments. Just put in your information with the broker, and they're going to talk you through what your needs are and provide you with the best options that they can.
There's no downside.
There's no downside, right? You have complete control whether you say yes, whether you say no, which one you pick, which policy you want within the provider. So you're in complete control. But one thing I've learned about this too, Ruth, is even for our own insurance, we didn't think that we could switch until the end of the year, right? So our
Right.
premium, our renewal comes up in September. And so we were thinking that we were going to hold on to our own until September until we realized that what we learned is that when you do have health insurance, it is on an annual cycle before it goes up again, right? But that's not a contract that we can really jump off of our plans at any time that we want to and go to a different plan. That it's not a contract, it's not an agreement, it's just a pricing structure. And I didn't realize that because I've been so faithful for years, right? It's like, okay,
Right.
we can't do anything until September 1st. But the truth of the matter is like that was kind of my own thinking about when the guidelines were, when it really isn't structured that way.
That's a great point. I'm glad you brought that up. So don't wait. If you want to check it out, go check it out now. You don't have to wait till your renewal time necessarily. Just you are locked in with whoever you have on your rate. But if you want to make a switch, if you want to change dance partners, you can do it.
You can do it at any time, and you can just take a look at what the competitors are. And you can take a look, even if you have health insurance already, you might find that you'll get a different rate through this than what you might already have
Right.
through the exact same provider. So it doesn't hurt just to explore and see what options are available.
Well, so glad that that has finally come to the community through you all. We're talking with Luann Feehan. She is the CEO of Nonprofit Connect, otherwise known as NP Connect, for folks who are involved in the community itself of nonprofits. I want to switch since we have you as an expert for this episode. I want to talk a little about, get a sense from you, what's going on in our community nonprofit wise. We are in a different era, different administration. We're not going to take any political stand, yay or nay. That's not our position, but times are different. There are funding cutbacks, either rumored or happening. What's your sense since you're dealing with all these organizations in our community?
Well, it's an interesting time, isn't it? And
Mm-hmm.
I think first of all, our sector is somewhat reeling from the standpoint of I truly believe that we were at the front line of COVID, right? During the pandemic, nonprofits were
Mm-hmm.
really kind of called to action to help with the healthcare aspect of it. You know, most healthcare organizations are nonprofit based. And then to get into justice and injustice and education, there was so much happening during the pandemic. And we were just starting to catch our breath from that. And now to go into the executive orders and what's happening federally with the potential cuts of federal funding, um, it's going to change the landscape of our sector, and it's already starting just with how the changes with immigration and DEI and what can and cannot be said or posted on our websites has already been a disruptor of much of what we do, right? Because our sector is known for covering a variety of areas, whether it's DEI, immigration, climate control, and then also working with those that are needing resources. So when
Right.
we take a look at the USAID and with Head Start and with Medicaid, you know, all of these different aspects are touching our sector in a variety of ways. So I think whether an organization is getting federal funding or not, our sector is all going to be feeling it. We're certainly feeling the impact in many different areas.
Well, I know during COVID, it was such a difficult time, and some organizations stepped up, got really busy. Some had to shut their doors. Some had to change missions. Then you come out of that, and the reduction or whole disappearance of funds that came in to help with all of that is now kind of out and gone. With that being said, what's the sense, and maybe it's too early, but what's the sense that you're seeing with nonprofit profits? Are there conversations happening with organizations of collaboration and merging and things like that? Are there? Tell us what
Yes.
you're hearing. You're hearing stuff.
Yes, yes to all of those, Ruth. Yes to all of those. I would say the answer really is fear. Fear of the unknown, fear because so many organizations have already received letters that their funding is not going to happen. Many organizations have received information that their grants have been terminated.
Mm,
Others that are on reimbursements are trying to get their monthly reimbursements in, but maybe there's no staff now on the other side to process those reimbursements. And nonprofits don't have a lot of cash on hand to like
right.
stockpile that. And so those are all big challenges. Mergers and acquisitions, I think we're certainly going to be seeing in certainly by the year end. I know that there's a lot of discussion already. And so, yes, I think maybe some of the good part of this will be that there could be some collaboration of organizations working closer together and finding their voice collectively together. That does not mean that they're going to go away because we still have a population that needs to be served. But I am fearful that we are going to lose a lot of that support. So let me just give you an example. I was having breakfast with an executive last week who has a budget of $9 million. $8 million comes from federal funds. And
Wow.
they're somewhat of a pass through, that they help with housing and they help with low to moderate income to be able to offset what they can afford in housing, and they pick up the rest. And so when you take that money out of the market, and about $40 million comes into Kansas City for housing from the feds, when you take that away, not only are you affecting people that are trying to get back on their feet, but then you also affect the landlords, right? Because that means
Right.
that they won't be getting their pay either. So, I mean, that's where the landlords are likely not affected at all by federal grants or federal funding, right? But the residual of it is that they will be affected. And then same with the clients or the individuals that are getting that housing. They won't have that option anymore. So what happens to those individuals? So it's going to be um, it's going to be dramatic, and I'm concerned about where our sector is headed and the amount of organizations that are going to be able to withstand this turbulence. And realizing that I don't know what the exact stat is, but I think it's about 33% of organizations are getting federal funding. Um, and so it's certainly going to affect those. I also know that organizations like we don't get any federal funding at all, but it's going to dramatically affect our organization too because of how it affects workforce, how it affects the budget to be able to have professional development, how it affects the budgets just to be able to have employees, because we're already seeing um, organizations that are either not hiring or letting people go as a result of this.
So, as your role is kind of I don't want to say umbrella for lack of another word, the connector in the community, what is NP Connect, your board, your committees, et cetera? How are you planning? What are you looking at? How are you trying to respond to an unknown, but some fears of what the future is to be?
Yeah, we're working on a variety of things. One, we are committed to being a resource for our members and for the nonprofit sector, and to be an advocate on how we address this change that is coming to our organizations. So we are doing our best to provide timely education. We are working with the National Council of Nonprofits out of Washington, D.C., who is doing an amazing job of watching out for nonprofits and really taking on some hard topics. And
Mm-hmm.
so with that, we have now a newsletter that comes out every other week that is directly from Washington, D.C., that is specifically for nonprofits. We've done a couple of webinars that have been convening our members just to talk through how is it affecting you? How is it affecting the
Mm-hmm.
sector? Because we don't really have the answers just yet, right? I mean, who
Right.
does? So at this point, we're trying to learn and assess what is happening, and then try to figure out how we can convene the right groups to move forward. And we certainly are taking a look at how can we help provide support, whether it's legal advice or marketing advice, or if your organization just threatened to have your C status revoked, like how do you respond to that? So I mean, there's a variety of things that we're working on. It's a busy time to try to monitor all of it and also be hopeful, right? I mean,
Mm-hmm.
the other side of this is we're not really exactly sure how to move forward. And as some of those executive orders get, walked back a little bit, I don't think our sector can recover from what has already happened. Um, and I think it's going to be pretty dramatic. The other part is just finding our voice. Nonprofits have not been known to be strong advocates in public policy and to stand up for ourselves. But at this point in time, it's about the future, not only of our organizations and our sector, but most importantly, the people that are being served and helped in our community.
Right. The societal impact. Even if, and not to say, again, we're not taking a position, but, there's decisions that go into play. And even if some of them have been reversed, quote, the impact has happened. And as you say, we sometimes tend to move more slowly, let's say, than the business community can. How to be able to do that. in the structure that we are and the way that we work. Are you all having conversations with funders, with foundations, and those kinds, whether they're private, public individuals? And if so, what are those conversations like?
Yeah, so the answer to that is yes. I mean, I think, Kansas City's always been known for being a strong philanthropic community. And I think there's a lot of concern from our funding community, everything from individual donors to philanthropists to our foundations to our corporations. Um, and to some degree, other corporations are concerned also, right? So
Mm-hmm.
I know of a large corporation that was trying to earn some business in Dallas, and they were declined because of language that they had on their website. So I know that it's not just happening in our sector, right? This is a broad scope of
Mm-hmm.
change that is occurring. Um, the other thing that we noticed last year, there was a strong decline in fundraising and a concern about it in our sector because after the pandemic, which took a lot of resources, we were thankful for the resources that we received. However, there was a steady decline, and our whole environment has changed since the pandemic, including fundraising. Fundraisers have kind of gone in to find their own niche or their own categories. So some of those areas have left other organizations that might have been used to receiving funds from typical standard foundations are not getting that any longer. So there was already kind of a shrinking, if you will, of the fundraising community. And then now for this to happen, it's a big concern that is on, I think, every executive director, CEO of a nonprofit's mind right now is how do we move forward, right? Because our business model is just different. We
Mm-hmm.
we don't get our revenue necessarily from fees for service or through the banks like the traditional companies would. So our business model is different, but yet we also need to figure out how to be sustainable in the resources that we get and how we bring them in.
Well, I know one perk of NP Connect is your great jobs area. To the point you're making about fundraising, I noticed, which I continually go glance at. I think it's very interesting to get a sense of moving in the sector, but so much of it is development work, which is, let's face it, is a churn in and of itself, but it seems to be even higher than it's been before.
Absolutely. I mean, it's the number one posted position on our job board, and it has been for years. So that comes as no surprise. However, a lot of our experienced talent got wary or retired in the past few years,
Mm.
and so we've got a whole new element of skilled fundraisers in our market. And because the need is so great, the expectations are large, and the resources are small. Right. So it's one of those jobs that's really demanding, but not always gives us the reward back as quickly as we want it to happen. And I will say that the other thing that has happened with the job board is I would say the number two position has been accounting and finance. And I think that was really happening during the pandemic. But what we're seeing now is like human resources has really
Mm.
kind of shifted that with the all the changes that have happened in the workforce and how the boundaries have been set and changed is making it harder for human resource individuals. And so we're seeing a lot of movement there also. So it's you're right to you're smart actually, Ruth, to take a look at our job board because it does kind of tell its own story of what's happening in the trends in the market.
Luann, thank you so much for your time. Talk about health insurance is where we started, but all the things that NP Connect is doing and what you offer and as a resource for nonprofits. So, audience, if you're not a member, I'm not getting a kickback, so don't think that. But if you're not a member, take a look. It's a resource that's available for your organization and has many aspects to it that may help you in these kind of uncertain times for all of us. Kind of a warm fuzzy to consider. Let's go with that. How about that?
How about that? And Ruth, I just want to say thank you for all that you're doing for our community and your years of support and educating nonprofits. So we appreciate you as well. So thanks for providing KC Cares.
Well, thank you. And thank you for joining us for Casey Cares. We're Kansas City's nonprofit voice. We're produced by a nonprofit called Charitable Communications. This Casey Cares segment was brought to you by the Ewing Marion Kaufman Foundation, www.kaufman.org. If you'd like to be a guest on Casey Cares, check out our website, which is kccaresonline.org. And you can spread the love. You find us on Facebook and Twitter at Casey Cares Radio and Instagram at Casey Cares Online. And don't forget, you can catch us on Saturday mornings at 8 a.m. on ESPN 1510 a.m. and 94.5 FM. Thanks for joining us on Casey Cares.